Welcome. We're really happy to have you here with us today for our second webinar in our ASQ Innovators webinar series. This webinar series is showcasing how users are making the most of ASQ and solving screening challenges. I'm Amy Klaus, Marketing Manager for Early Childhood Products at Brooks Publishing, and today we have Shannon Ellison from the Collaboration for Early Childhood in Illinois with us today to talk about a training plan she developed. So welcome, Shannon.
Thank you, Amy.
Thank you.
Thank you, everybody, for attending.
Before we get started, if you'll move just to the next slide, I have just a few tips for listening for today's webinar. Oh, one more. We recommend you close any applications that take up bandwidth just for a better viewing experience. If you have audio problems, just double check that your speakers are turned all the way up, and you can always disconnect and reconnect to the webinar. You can type your questions into the questions panel, and we'll be taking those at the end of the presentation. If you'll go forward to the next slide, please. There is a survey, and we would really love to have your feedback, and we'll be picking one respondent to win a free book, so I encourage you to fill that out. And then you'll also receive a certificate for attending today's webinar. We'll share a URL at the end of the webinar, and everyone listening live will receive a link to a certificate in a follow-up email tomorrow. And we are recording today's webinar, and you'll receive a link to the recording in a follow-up email as well. The slide handouts are in the handout section of our webinar, and there's a link in the chat box. So if you want slide handouts to follow along, they're in there. So now I'd like to go ahead and introduce you to Shannon. Shannon has served as the Developmental Screening Coordinator and as the Manager of Health and Development for the Collaboration for Early Childhood since January 2014. She holds a master's degree in early childhood education from National Louis University. She brings more than 25 years of experience working with children and families in various positions in childcare, early Head Start and pre-K, and statewide early intervention programs, as well as those experiencing homelessness. All of these roles speak to Shannon's passion for serving families to meet the needs of their littlest members to develop into their full selves. So thank you, Shannon, for being willing to present this. I'll turn it over to you now.
Great. Thank you so much for that wonderful introduction, Amy. And as Amy said, we will be talking about a training plan that I developed that we use in our community-wide ASQ screening project here at the Collaboration for Early Childhood. The objectives, what I hope you'll get out of this session today is I want to outline our 8-part developmental screening training plan for you. I will also give you some tips for effective training sessions, and I also want to suggest some important factors to consider as you are planning your own training sessions. So a little bit of context. I'm going to zip through a little bit of context for you. On the Collaboration for Early Childhood and our community screening efforts. I'm sorry, I'm losing my place here. I want to give you a little bit of context. So the Collaboration for Early Childhood is a nonprofit organization located here in Oak Park, Illinois. Since 2002, we've embraced the vision that all Oak Park and River Forest children should arrive at kindergarten safe, healthy, ready to succeed, and eager to learn. We are a unique public-private partnership and a collective impact organization. So we are primarily funded by the elementary school district, the high school district, and the village, but we also receive financial support from other municipalities as well as private donors, very generous private donors, and some public grants. Behind the work that we do, there's a story which includes 76 various community partners, and I'll show you a little bit about some of the people who make up that story. But overarching, the work that we do is that we are asking always the question, are the children getting what they need? That is the one thing that drives the majority or all of our work. So I talked about, it's not working for me. Okay. I talked about some of our 76 community partners, and this is a little bit of the story of the collaboration. So as you can see, our work is to get those kids to kindergarten safe, healthy, ready to learn. We do that by offering some coordinated intake services. We work with health providers, families, early childhood staff, kindergarten teachers. You'll notice that we have our healthcare providers represented here, and they're on the far left of your screen. We work with these professionals to encourage developmental screening in their practices and also to communicate with those other players in the early childhood support services and referral arena. We also offer to those providers two professional development opportunities that are early childhood health related during the course of each year. We actually just released a couple of webinars for them that you can find on our website. Now, you'll see here we have the families and early childhood in between them. This is where our screening work is focused. So our developmental screening efforts have always been about more than just having screenings completed, but about, again, are the children getting what they need? So we emphasize greatly what happens with those children and those screenings after the screenings are completed. Here's a picture of our program model. So as you can see here, we have 4 program areas of our work, and then the concepts that you see in the outer ring both impact and are impacted by each of the program areas. The program area where our developmental screening work is focused is in the health and development area. So a little bit about where our developmental screening project started to where it is now. So January 2013 to June of 2014, the collaboration received a grant to provide some social emotional screening work. At that time, we had 10 screening partner programs that we were working with. And also at that time, the collaboration didn't have a developmental screening coordinator who was dedicated to that work, but they did have 2 hardworking individuals with the collaboration. So our early learning or professional development coordinator and one of the director roundtable consultants, they both worked with those program partners to complete screening. In January 2014, developmental screening coordinator was hired. That was me. So then I was able to focus all of my attention on developing this part of the work. In July of 2014 to June of 2015, we were able to increase our screening partner programs to 20. Pilot incorporating the ASQ3 into the screening work. We embedded this training that we're going to talk about today, as well as a coaching and mentorship program into that work. And we also invited medical practices and home visiting service providers to participate. In July of 2017 to June of 2018, we also incorporated some community screening sites. So a local area children's museum and one of the local area public libraries also has accessible ASQ screening kits available to families in the community. Recruitment of new early childhood and health providers, as well as medical providers, is always ongoing. Here is a little bit of a chart so you can see our screening counts and how they've changed over the years. So in the beginning with the more limited developmental screening efforts, we saw in the smaller pool of program sites, we saw a smaller number of those ASQ SC2s completed, or SEs at the time completed. We have graduated everyone to the ASQ SC2. And then as time went on, you can see that our screening counts have increased. So that's just to give you a little bit of context so you'll understand a little bit more about our community-wide developmental screening program. Amy, can you go ahead and release the first poll for me? I want to get an idea of how the makeup of the audience. So who are you all responsible for training?
Sure. So I just put the poll up and it looks like people are starting to respond.
Okay.
So just leave it open for 30 seconds or so and see how people respond. So thank you to those of you who are voting.
Thank you so much.
Okay, look like we have a split between some different audiences. Okay. Thank you, everyone. I will close the poll now and then it will show us the results. And I'm going to share the results. So Shannon, can you see the results there?
It doesn't look like I can from here, but
So it looks like, let's see, 27% of listeners are responsible for training parents and caregivers.
Okay.
44% train community-based early childhood professionals.
Okay.
Then 5% train school district professionals, and 17% train Head Start professionals, and 7% train healthcare professionals. So most people
Okay.
are training community-based early childhood
Early
professionals
childhood.
or parents and caregivers.
Great. Wonderful. Thank you for that. And then you know what? You can go ahead and release poll 2 at this time
Okay,
as well.
great. So this is, do you currently offer a developmental screening training plan?
Right.
Okay. So we're starting to see some votes come in.
Great. So while you all are answering that poll question, I'm going to go ahead and take us to the next slide and talk about some of the guidance that I considered and that I think is important for everyone to consider when developing a training program. So I looked at the American Academy of Pediatrics recommendations for developmental screening and their Bright Futures guidance. I looked at state and local early childhood quality recognition and improvement system requirements. I reviewed the ASQ user guides. I looked at NAEYC guidance, National Association for the Education of Young Children guidance on developmental screening work. I looked at any federal, state, or local laws that we had that were governing or guiding our developmental screening work. And I consulted Brooks Publishing's Developmental Screening in Your Community book.
So I'll go ahead,
So,
Shannon, and
yep.
and share the results. So it looks like 38% of people do have a screening plan in place, and 43% do not. So it's pretty close. And then 19% are in the process of developing one.
Great. Thank you for that. And so when I looked at these different the different guidance that was out there about developing a screening program, one of the things that I considered greatly was our state early childhood quality recognition and improvement system requirements, and I'll talk a little bit more about that as we go on. So we have one more poll that I want to take, and that's to ask if any of you have any state or local quality improvement or credentialing systems in your area.
Okay, so I just opened it up.
Okay.
Looks like votes are starting to, people are starting to submit answers.
Okay, great. So here in the state of Illinois, we have what's called Gateways to Opportunities, which is a credentialing system for early learning professionals. It also helps them keep track of their professional development hours. And you can receive, or early learning professionals can receive Gateway's credential credit points by attending training. But in order to attend a full credential credit point, you have to attend a 15-hour series of training in a particular topic. And so you might notice that the first 7 sessions, when we talk about them later, total 15 hours. And I did that intentionally. And I got this training system that we're going to talk about today approved for 1 credential credit point for those early learning professionals that attend all of the sessions.
Great. All right, so I've shared the poll on the screen now. So 48% of our listeners aren't sure whether their local QRIS includes developmental screening, but 40% of people say it does.
Okay.
And then there's a handful of people that say it doesn't, or that they don't have a quality rating system.
Got it. Okay. And another thing I wanted to say about the quality rating system, we also have Accelerate here in Illinois, which is the system that is the quality rating system for the early learning programs. And in order to achieve the 2 highest levels, they operate off the Olympic medal system. And so to achieve those silver and gold levels of quality, you do have to have a developmental screening program in place, to the extent that it includes parents or some other particular features, that will determine if you make the silver or gold requirement. So I also consider that when developing our training plan. Some important points that I like to emphasize during the course of implementing the training with the attendees is the difference between screening and the words testing, evaluation, or assessment. People use those words interchangeably, but they are not the same thing. And I consistently emphasize the difference to my training attendees. I think that implementing a training series also introduces these concepts for future reference. The information that we're going to talk about today, it is a lot of information for the attendees to take in, and they sometimes feel like it's very overwhelming, but I remind them that I'm not giving them this information because I expect that they will memorize it all, but so that they will be familiar with it when we are talking about it or when things come up in the future. I think the training process also builds and strengthens my relationship with the participants, the audience members. I'm getting to know where everybody is with their knowledge and experience of screening and referral and where they might need some additional support, and we're building that relationship. Training also is providing us an opportunity to change the narratives about screening, in that screening should just be a part of normal child development. It should not be something that only happens when there is a concern. And so that allows us to start to change that narrative for people, as well as to emphasize the value of family input to the process. To really help early learning professionals or medical providers or whoever's in the audience to really understand that while they may be seeing children for a large portion of the day, it is the family that sees them in different contexts and with different people, and they have a lot of valuable information to offer in the screening process. Also, as a part of our developmental screening project, we offered our program participants ongoing coaching and mentoring support, and I find that that's been invaluable to them, that they know that there's some support and help going forward. So now let's dig into the building and implementing your developmental screening program training plan.
Shannon, I'm sorry to interrupt. I
Yes.
think we're stuck on the poll page, so I'm going to quickly take are you moving your slides forward?
Yes.
Yeah, 'cause I'm stuck on the, I think I'm going to quickly take control back and then give it
Okay.
back to you real fast
Okay.
to see, just to make sure to see if that clears it out.
Okay.
Okay, I just gave you control back. Hopefully this will, there we go. Yes, that
We're
looks
good.
great. Thank you. Sorry
Okay,
about
great.
that.
No problem. Gotta love technology, right? I think I say that in every virtual session that I'm in, somebody has to say that. It's
I
the
know.
it's the obligatory statement. So let's dig into this training plan. So on this slide, you'll see the list of all of the sessions. So those that I have listed in red are part of the 15-hour package, which when all taken together, as I mentioned before, are approved for one credential credit point of training for Illinois early childhood professionals through the Gateways to Opportunity professional development system. Credit can also be earned for each session independently, if they do not take all of the sessions. These sessions have been offered either once a week, twice a week, as well as over like 2 full-time weekend days across 2 weekends. So I've kind of done a variety of different things in order to offer this 15 hours to people. That session that you see in the aqua color is an additional session, which is also required for our developmental screening project participants, but it happens at a later point in the process, usually just after the beginning of the program year, and it's really designed to support their decision making in determining what kind of follow-up actions might be appropriate for those children that are identified as having some developmental needs. In terms of this whole training program and our program participants, they are required to send at least one person, the person that's assigned to be the developmental screening point person, but they can send as many of their staff members as they would like to training. And I make sure to feed them well to keep them happy, especially if we're meeting with them on the weekends. So now let's jump into these sessions. So part one, we go over the phases of the ASQ screening program. And this is really the information that's found directly in the user guide. And even though we have predetermined a lot of the things that come up in this phase, in the different phases, or we've taken care of a lot of the thinking or the requirements that are required to be able to implement a screening program for them. I still think it's important for them to know all of the things that are required, all of the tasks involved, all of the pre-thought and work that has to go into just the design of an effective developmental screening program. This is by far the driest part of the training series, but I let them know that in advance, and then we kind of get through it. So I thought what I'd do is, as I show you each part, I'd also show you at least one activity or takeaway from the training that we found to be very helpful. So one of the things that they get in part one is they get this implementation map. And I'm a visual person and I like colors. And so I follow the stoplight color system in order to be able to lay out the order of the different actions in the implementation process for folks. And so this is the first time that this implementation map appears, but we will see this again. And then they also get this chart to take back to their programs with them. And so they can consider what staff and resources they already have to manage each phase of the process and what they might still be missing or what they might need. Part two, we talk about screening, conference, and referral protocol development. So we talk about the purpose of the program, developmental screening program goals. We create a developmental screening management system. We talk about roles and responsibilities. So who's going to do what and how and what that all will look like. And we talk about the activity cycle. So during this part of the training series, we see the implementation map again. However, this time it incorporates the associated tasks into that implementation map that we've already seen. So it kind of starts to get them used to what is happening in each part of that implementation map. This is the first page of a protocol document that they receive. So when they get this document, this is a fill in the blank document for them to really think through what the developmental screening process is going to look like in their programs. So some information is pre-populated on this page and throughout the document because there are stipulations of project participation, like we screen children twice per program year. We use both the ASQ3 and the ASQ SE2. We screen all children. So those are some of the things that are required as to be a project participant in our developmental screening project. But there are also several other sections of this protocol document where programs have the flexibility to reflect their program culture and what types of systems and processes will work best for them. So this is another page in that developmental screening, monitoring, and referral protocol document, and this is our at a glance page. So this is a very high-level summary of the tasks to be completed in this program. And then this section further breaks down all of those high-level tasks into smaller details, and this really encourages project participants to think through what the processes should look like for them. And they're again reminded, though, that this is a living document. So what they put in this document the first year is very likely to change over time. I like that this document is completed by them and that they have access to it all the time. So if administrators, program staff, parents, anybody has questions about how they implement their developmental screening process, who's supposed to do what, how are we supposed to do that, they all have one unified document to go back to answer those questions. And I provide them with this document and we work through it during this part of the training course, but then they are allowed to take it back to their program and complete it. And then I ask for copies of these so that later as questions come up, even for me, I can refer back to what their system should look like for their program. And this last page is where I provide them with our screening round dates for the program year, as well as some other ongoing dates and information. This is provided to them in the protocol document the first year when they are training, but then we also provide this document to them every year when we update and execute our letters of agreement for their participation, so that they always have this information current and available to them. Part 3, getting started with the ASQ system. So we start this session out with the developmental domains review. I always share with them that I have been a developmental therapist in the early intervention system. And sometimes because I spent a lot of time working with children with developmental delays, it's really easy for those developmental expectations to become skewed over time. So we start with a developmental domains review so that we're all on the same page about what those general milestones and timelines look like for children. Then we dig into the actual ASQ3 and SE2 questionnaires. We look at the information summary sheets. We look at the support materials available to them. And we actually review some completed ASQ3 and SE2 screening questionnaires. We look at those samples. And then about half of this training time is spent working with some case studies and examples. Because these are primarily early childhood learning professionals or health professionals that I'm working with, I'm able to cover both screening tools in 1 2-hour session, and we do some practice with them. Here's where audience comes in though. If I were going to do this for parents, I would probably break that down and spend more time working with each different tool separately, but that really would be based on what their knowledge of early childhood development is, what experience they have coming into it with developmental screening tools. So here, our implementation map again, but at the beginning of this session, they're given this implementation map in pieces. So each rectangle that you see is broken down into a separate sheet of paper. They're given some masking tape or some sticky tack or poster putty, and they're asked to put the pieces in the order that they would happen on the wall. So they're basically asked to put those pieces to rebuild this implementation map on the wall. They really get a kick out of this activity, and I think it really helps them to start to understand the processes and how they flow together. Another thing that we do during this part of the training plan is we give them this ASQ3 and SC2 test your knowledge, and we do it as a pretest, but then we review it at the end so that they can document what they've learned during the course of this session. Okay, part 4, we talk about effective communication with families. This session is really important to diminish any aversion that program staff or other members of the audience might have about having what might be difficult conversations with families, which would then in turn lead to their resistance to screening. You know, some people may feel like I don't want to have to talk to a parent about a possible developmental delay, so I'm just not going to screen. So I didn't want that to be the case for any of our program participants. So I incorporated this piece into the training program. So we talk about developing a sense of community with others, things to keep in mind. I give them tips for sharing screening results and also providing families with next steps. And then we practice. So again, about half of the training time is spent in role play. So they watch a role play model and then they do some small group role play. So in their small group role play, attendees are divided into groups of at least 3 members, and each group is given some case studies that were found in the user guide, and one member in the group represents each of the following roles. So one person gets to pretend to be the parent or caregiver, one the provider, and one is an observer. Okay. And so then the group will role play each scenario of just basically having a conversation to report out developmental screening results, maybe some concerns, maybe some positive responses. And while they're doing that, the observer will be using this sheet to identify those strategies and skills that were displayed by the provider. And they also have an opportunity to document some notable feedback for the participants during those interactions. We report out as a large group, and then they go back and we role play again. So we do 3 cycles of this, and that allows each member of the group to get a chance practicing each role. Okay. So part 5 is using formal screening and informal assessment to inform our practice. So we talk about formal screening and informal assessment and what's the difference between those two. We gather strengths and needs from formal screening and informal assessment. We do, again, some case study activities, and then we apply what we know. So, how to make adjustments to capitalize on children's strengths when we're looking at our lesson planning and our activities, and also ways to provide support in areas where some children may need some additional support to be successful. And then we share out as a group. So this is an example of some of the information that they're provided as their case study. These are actual ASQ3 and SC2 questionnaires for children, but they've been de-identified and they will receive them. So they'll get an ASQ3, they'll get an ASQ SC2. They'll also get a teaching strategies goal document, and this is a developmental, an early childhood assessment tool that the program that I got this from uses for their classroom. So these are actual responses, again, de-identified. So when they're doing their case study work, they're looking at real information, and then we look at some real activities, and they figure out what kinds of things might I need to change about these activities in order to ensure that this particular child is successful. Part 6 is when we jump into putting ASQ online to work for you. So this is when we introduce them to the system and what the benefits are of using ASQ online. I review with them the differences between the program administrator role and the provider role. We do a little bit of program setup and navigating ASQ online. And then we talk about some of the major tasks that they would be responsible for in each role. Um, During this session, it's a really high level overview. Um, and what we're doing during this session, they're walking through the system in a hands-on way, but they're also reviewing a packet of screenshot handouts that I created for them that they will have with them as they go back to their programs and begin to play around in the system and start to screen in the system. They will always have this to refer back to. So I give a packet of screenshots for program administrator level activities. And this is what one page of those screenshots look like. And then I give a separate packet of screenshots for the provider level attendees. And this is what one of the pages of that screenshot packet looks like for them. So after we've done all of that, we come to our final part of the training series, and that one is putting the pieces together. So between part 6 and 7, when at all possible, I ask the attendees to complete and submit screening questionnaires online on fictitious children using ASQ Online Family Access. And this is so that they will gain some familiarity with the family's experience of accessing the system. This will allow them to be able to answer questions that families might have as they start to work in the system. So during this final session of the core training, attendees will have the opportunity to put everything that we've already practiced into place. So we go from start to finish. So we discuss navigating ASQ Online again to get to family access, complete an online screening. We do a little bit of manual screening entry. So I show them a screening and then I ask them to verbally guide me through the system to how to manually enter it. We do some accepting and rejecting of screenings using some instructions that I developed for them. And I'll show you that in a minute. We review screenings using the instructions provided, which I also developed for them, which we'll take a look at in a second. And then we determine what kind of follow-up might be needed based on the screening results. This says that we document follow-up in the child's profile, which now means on the information summary page, since we can now generate reports from there. Previously, I created a lot of custom fields in the child profile so that they could document what happened after screening. But then we talk about sharing results and feedback with families. We might do a little bit of role play on what that might look like. We will generate some reports. The reports that I most commonly use to monitor our screening program are the screening status summary report and then those ASQ3 and SC2 screening results by child reports. Then we talk about how we might use the screening information to plan or adapt activities or lesson plans for the particular child in question. We take a look at screening management and look at how to access and download some ASQ Online documents that might be appropriate. Okay. So one of the documents that I've created for them to use and keep and have on hand is a step-by-step instruction sheet for how to accept screenings through Family Access without creating duplicate child profiles in the system. So this looks like a lot of detail because it is literally step by step. Like log in, click on Family Access, you'll see this. The arrow next to the name of the child looks like this. Fear not, however, at the end of this document is a simplified cheat sheet, which looks just more like a checklist of really like high level reminders of how to do this. Um, Providers may access this document for future reference. So if they can't get a hold of me or if I'm not available for them to ask, this helps build their self-sufficiency because they have access to this document. The other document that I created for them that I found really helpful and important to them is how to review completed ASQ screening. So again, we have that very detailed step-by-step, what they're looking at, what it means, how to identify red flags and all of that type of information. But then again, at the end of this, there's another high-level cheat sheet, simplified version that is really for those that only need reminders. That last session that I talked about, the developmental referral and services session that happens a little bit after the start of the program year, we are looking at early intervention and early childhood special education. So what's the referral process? We actually have some piloted streamline referral processes for our local school districts because they understand that the program participants that we are working with have had extensive training, are working with developmental screening, and have additional supports. So they feel comfortable sometimes engaging in a more streamlined referral process with those providers. We look at what the evaluation process is for early intervention and early childhood special education. How is eligibility determined? What kind of services are available? And what does the transition between the two look like? Here in Illinois, those are still two separate systems. And so what does that transition mean for children when they turn 3? We're also talking about communication and referral with outside community service providers. So not necessarily the public service providers, but what about to the primary care physicians or therapists, private therapists? What does that look like? The collaboration has worked really hard to adapt our care coordination form and add a letter to that so that we can share referral information with the child's primary care physician so that we're all on the same page. And so we talk about that during this session. And then we do a little bit of a knowledge post check. What's special and unique about this session is that while I present on the components developed and supported by the collaboration specifically, the majority of this information is presented by the actual local school district and early intervention intake office representatives. So they come attend this session and review, excuse me, the information with the training attendees. What's also been another golden nugget about this training session is that as the local school district representatives realized that they were presenting the same information, they decided to get together and develop one PowerPoint that they both took turns presenting, and they would only address like those things that would be different between the school districts, but they came up with one unified PowerPoint. And so it's actually started to get them to work together a little bit more collaboratively as well. And it also begins to build a relationship between those, the audience members and those referral entities, which might otherwise seem a little bit more out of reach. The knowledge post check. So this is a pre and a post check. So they get this document at the beginning, they attempt to answer the questions, and then we review the answers at the end of the session and are able to answer any questions that they might have. So throughout our implementation of this training series, here are some of the key factors that I consider. I mentioned earlier that I look at the audience availability, and I also consider the audience's chosen screening method. So if I am presenting to an audience of providers that will not be using ASQ Online, then that's going to eliminate session 6, and it's going to change what session 7 will look like. If my audience is a group of early learning professionals versus health professionals versus a group of parents, that's going to change what my training plan looks like. So I also, as I mentioned before, consider our quality rating system credit requirements. I also consider if there is a possibility to offer coaching and mentoring support to the training attendees after the training. I also see the training series as an opportunity for relationship building with the audience members. So the training plan is adapted based on these and possibly some other factors to meet the needs of the audience and really based on their knowledge of child development, screening tools, their experiences. For example, my health professionals have an extremely abbreviated version of this training plan. If I were to develop, like I said before, a training plan for parents who might not have much child development knowledge beyond their own parental knowledge or experience with administering screening tools, I would spend more time on the ASQ3 and SC2, breaking them down into smaller sections. This training plan, however, is highly customizable for audience criteria, culture, context, and goals. So I think I've done a pretty good job of telling you about all of the pieces of the training plan that I've developed. I'm happy to answer any questions that you may have. I'm going to put my contact information up on the screen. Um, and then I am also going to add my cell phone number because we are still working remotely. So I'm also going to add my cell phone number into the chat. I did not want to put it on a slide for recording, but I am happy to answer any questions that you might have.
Thank you, Shannon.
You're very welcome.
That was really interesting to hear all about your really thorough training program that you've developed. We did get some questions already during the presentation. For one basic question, just to go over, you mentioned community partners in the very beginning. So can you talk a little bit more about the types of community partners that are involved?
Absolutely. So we work with local area family child care providers, early learning center-based programs. We have some medical practices that are in our developmental screening project. Like I mentioned before, the local area children's museum, a public library, and home visiting providers. So really anybody that's working with or with access to families and children. And actually the Collaboration for Early Childhood, our 76 partners covers the gamut of anybody who's active, involved, interested in the lives of families and young children. But in the developmental screening project, it is those categories of providers that I named. And currently this year we have 28 program participants engaged. 3 medical practices, 1 home visiting program, the 2 community sites, 2 family childcare programs, and the rest are early learning center-based programs.
Thank you. We had a listener ask, do you charge the providers to participate in the training, to receive the training?
No, we do not. We do not charge for training or coaching and mentoring support.
Okay. You just provide that as part of your organization.
Absolutely. We provide that as part of the work of our organization, and that's part of what our very unique funding is paying for, is to improve the quality of early learning and early childhood resources in the community. So that is what the only time that providers are ever charged for anything, it is for the per screening charges that accompany our ASQ Online account, and we even come up with some very unique and interesting ways to try to eliminate or offset those costs for them as well.
Great. We had another listener who was asking, so you talked about, I know your community uses ASQ Online. Do you, in order to receive the training and to be included, do you require them to participate in ASQ Online? Do you have any print users?
We do require them to the greatest extent possible to at least offer ASQ Online as a completion option. If they, however, we do also require them to be flexible though. And so if their clients, if their patients, if they're the children enrolled in their programs, if those families require a paper questionnaire, we absolutely encourage and expect that they will provide them with that. We also expect that they will help them if there's language barriers or any other types of barriers. We expect our program participants to help families overcome those, or it to the extent that we can help with that, we can do that as well. And so that is also why we go over how to manually enter a paper questionnaire into the system. So while the family may not use ASQ Online, we do expect the program to be engaged with ASQ Online. And a big part of that is because another big part of our work, you might have seen it in that red circle around our program area, is data collection. So we want to make sure that we have access to knowing how many of those children are getting screening on a regular basis, and then if there's anything that those children might need, that we're following up with those providers to make sure that they're helping those children get connected to any additional resources that they might need, and really understanding how we can help them do that.
Great, thank you. We have a great question from a listener who mentioned that this taking the training is a lot of time for childcare providers, and what are the benefits that childcare programs seem to appreciate the most after going through the training?
So I think it's for us, it's so first of all, we make it as convenient as possible for them. So if I'm doing once or twice a week training sessions with it, 2 hour to 3 hours training sessions with them, we do them in the evening, and I provide them with dinner, like a full dinner with dessert. We're talking lasagna, fried chicken with sides, like full dinner, because I do understand that it is time. It's a very valuable time. The other thing that I think they really appreciate is the fact that they can get professional development credit for attending each session, but that they can also then earn that full credential credit point by attending all of the sessions. So we try to make it as beneficial for them as possible and really help them understand how much we value and appreciate their time.
Great. Let's see. So we have another listener who's asking, how do you get buy-in from pediatricians? She's commenting that she finds that difficult.
It can be very difficult. But I think just using like those AAP guidelines and Bright Future standards is one way, and also helping them to understand, like, if this is something that they haven't been able to do, like, we're there to kind of help them figure out an algorithm that will work with their practice, where we're kind of supporting that, like we're giving them a way to be able to do this and access it in an online way. So those three medical practices that work with us, they each have their own ASQ 3 and SC2 links. So because I'm behind the scenes making sure that those things are linked together and looking at how they work, I give them the link. They put them on their website or share them out with parents in preparation for their well child visits. That's something that they don't necessarily have to think about. I do still have challenges with my medical partners sometimes with getting the follow-up information. Actually, one of our medical practices gets the most screening, that has the highest number of screenings completed every month. They're very, very consistent with getting their patients to comply. The only thing that I, like I said, have difficulty with is when it's time for me to figure out what happened after for those children that might have scored in the refer range or the monitor range. That might get a little bit tricky. I also have another medical practice that we've been trying to bring on board, and one of our challenges has been trying to figure out an algorithm and process that really works with how their practice is set up. Sometimes the hurdle is none of that. Sometimes the hurdle is simply the business associates agreement. So it really just depends on the medical practice, but I think leaning on at least the AAP guidelines and Bright Futures is a good start. And while I do make it available to them to meet at least those minimums, I encourage them to move towards screening at every well child visit. So that's still a work in progress for some, but for others, it's just what they do. And then we do something a little bit unique too. I figured out a little bit of a way to trick the system. And so, what I also make possible is if a parent completes a screening for one program in our network, they can give us permission to share with another user in our network. But I do all of that manually behind the scenes. But it makes it nice for parents, it makes it nice for providers because they're always getting the most up-to-date information on the children, and everybody's seeing the same information, and parents are only having to complete screenings once.
Great. Thank you. We're having lots of listeners ask about how they can enroll or get trainings like this in their state.
Okay.
Shannon, if you want to talk a little bit about
Yeah, do you want to, or you want me to? Either
no,
way.
I mean, you could just explain that this is something you've developed.
Yep, it is. It is something that I developed for the collaboration for early childhood. And right now, because of our funding, a lot of times we're limited to what we can do Oak Park and River Forest. But training is an area that we would consider being able to expand our boundaries, at least during the state of Illinois. Outside in other states, I'm not sure if the collaboration would go out that far, but I know that I develop the training plan and I implement the training and I put a lot of the detailed work to expand this project. And so I also um, would be available to provide some additional supports to organizations and entities where the collaboration may not be able to reach. I can do that personally.
Great. So we can share information for those of you who are asking with Shannon for after the
Yes.
webinar.
Yes, and you have my contact information for the collaboration on the slide, as well as my cell phone number in the chat.
Great. Let's see. We have a listener asking, speaking about the pediatricians, there's been some interest in Medicaid reimbursement for screening. Is that something you explore when you're training pediatricians about how they can get reimbursement?
There already is reimbursement for developmental screening. There's one code, and I cannot remember the codes. It's been so long since I looked at that. But there's one code for the ASQ3, and there's a different code for the ASQ SE2. But there already are reimbursement codes for developmental screening. It really does just depend on the insurance provider. And I believe that Medicaid would reimburse for that, but I'm not 100% sure, so don't quote me on that. I haven't looked at Medicaid specifically, but I do know that there are already ICD-9 codes for reimbursement for screening, especially since it's in AAP and Bright Futures.
Let's see. Oh, we had a couple people ask whether you could share some of the documents that you shared, fuller size versions. So particularly, we had someone who, see if I can ask which, let's see. I think it was the sheet about role playing.
Oh, okay. That the observer would use to check off the skills that they saw happen during the role play. Sure.
Yeah. So we can follow up. We can send some information in the follow-up email if you're interested in receiving some of those documents. How to contact Shannon.
Absolutely.
Shannon to get those. We have a listener asking, other than the resources developmental screening in your community book that you mentioned, are there any other resources that you would recommend other people interested in conducting trainings check out?
I mean, really just those resources that I listed on that slide. So you'll get that slide in your packet, but really just looking up, what's required by law, what's required for early childhood program licensing in your state or your local area. If you finding out, for those of you who weren't sure if you had a quality rating system, what looking to see if you actually do have one. And for those of you who don't have a local quality rating system, looking at maybe what's available in other states that you might even replicate, even though it's not a requirement in your state, looking at what other states and localities are doing to document quality in their states. Those are good places to look. I highly recommend that you look at the AAP Bright Futures guidance. There's something called a periodicity schedule, which sounds super complicated, and it's a really big, busy chart. But there are links in it. And at the bottom, there's one little tiny footnote that talks about developmental screening. But if you click on it, it will give you more information about what physicians are encouraged to do. They actually, it's suggested that they of course are conducting developmental surveillance all the time, but at the 9, 18 and 24 or 30-month visit, they're actually supposed to use a valid, reliable, research-based screening tool to track their patient's development, and all of that's documented there. So really all of those resources are what I looked at when I developed this training plan to make sure that I was covering all of the bases. But that developmental screening in your community book is really, really good.
Great. We're having some listeners write in to say that, there are different codes in different states for Medicaid reimbursement in Texas and
Great.
in Iowa. So yeah.
Great. Thank you for adding that.
Yeah. Let's see. And I did, everyone just put Shannon's cell phone number is in the chat now. So if you didn't see that at first, sorry about that. It is in there first.
Thank you.
Let's see.
And just if you call me, leave me a message and I will call you back. I'm just not always sure when I get phone calls from other places if they're real calls or if they're spam calls. So, but if you leave me a message, I absolutely will call you back.
Let's see. We have a listener asking, would you consider ASQ community screening to be a good starting point for a growing community that has a need for cohesion and quality early learning?
It could be if you can figure out the cost structure and the costs around it. Like if you can take care of that, that can be a good starting point. I think just finding those things where people have some common ground. So if you think about what I mentioned before, we do for our physicians network. So we offer those 2 professional development events per year for our medical providers, right? There have been times in the past where, depending on the topic, it was also a topic that was very relevant or highly sought after for our early learning professionals as well. And so we invited both groups to attend, and that's a really good way to get people to start networking and talking about a common goal. So I hope did that answer your question about one good way to maybe get that to start happening in your community, to start developing those relationships. We haven't had our health professionals attend the 15-hour training session. So when I say they get an abbreviated version, they really just get me walking their point person through the online system, talking about how to accept screenings and how to review screenings. But there are other ways that we get them to work together with us.
Great. So thank you so much for everyone who's listening, and thank you, Shannon. I just have a few more slides that we'll go over. So Shannon, if you'll move forward the slide deck for me. I wanted to let everyone know we're having another webinar in our ASQ Innovators webinar series, and the URL's on your screen and it'll be in the slide deck as well, so you can register for that. It's about using ASQ Online for child find efforts in a school district. We also are planning to continue our webinar series in the fall. So if you'd like to share your program story, please reach out. Please reach out to me and I can chat with you about a possible webinar next fall. We're also holding coffee chats every Wednesday. And I've highlighted a couple that are relevant for early childhood and ASQ users. So I encourage you to check out these. Those are free webinars. And then just in case you're not familiar with the ASQ website, there is a wealth of free resources for professionals and for parents. Lots of activity sheets you can share, lots of resources for how to use ASQ. And there's a free registration process. You can sign up for an ASQ newsletter to monthly get new resources. So I definitely encourage you to do that.
Yes, those are awesome.
Thanks. The next up, please, just another reminder to fill out the survey that's going to pop up at the end of the webinar. It'll also be a link in your follow-up email tomorrow. And then for those of us who are listening to our webcast recording, this is the URL where you can jot that down and go get a certificate. For those of you who are listening live, there's a certificate that's been uploaded in the handout section, so you can download that now. You could follow this URL to go download it, and then you also could, it'll be coming a follow-up email tomorrow. So you can choose which way works best for you. But thank you so much, Shannon, for being willing to participate, and thank you for everyone who's listening today.
Thank you, Amy, and thank you everybody for joining. I really appreciate it.
Great, and we hope everyone has a great rest of your day. Bye-bye.